Welcome everyone to Breast Cancer Care WA's webinar. Today's topic is eating well with metastatic breast cancer, and the content will be presented by our wonderful, very experienced, very knowledgeable oncology dietitian, Adele Hug. Before I hand you over to Adele, I do want to acknowledge the traditional custodians of the lands that we are streaming from today. We here at Breast Cancer Care WA are on Whadjuk Noongar Boodja, and we offer our deepest heartfelt respect to the elders of these countries, these traditions, who have taken such good care of the land, the air and the water for so many thousands of years. It's a great honour to be here with all of you, and so I'm going to hand you over to the fabulous Adele, who will take us through today's session.
Lovely. Thank you, Chandrika. And a big thank you to Breast Cancer Care WA for the opportunity to come and speak to you all today. So as Chandrika said, we have our final session today for this series, which is Eating Well with Metastatic Breast Cancer. So I'm just going to share my slides and take you through the session today. Now, as some of you may have been to some of my sessions before, but some of you may not. So there will be a slight overlap with content today, but hopefully it will all give you a great foundation to eating well with metastatic breast cancer. There can be some sensitive issues discussed today, so I completely understand if there's a moment that you do need to step out and take yourself away. And always, as I know you all will, is listen with respect. What I will also say is please do comment or ask questions as we go along. And then I'll be doing a Q&A at the end of the session. So we'll have a big opportunity to sit together and answer those questions and hopefully be able to address anything that maybe I don't discuss if you did want to talk about it today. So yeah, please do that either in the chat or the Q&A, depending on what you can see. So obviously we couldn't do this session today without the support of Breast Cancer Care WA, and they support thousands of women and men and their families affected by breast cancer across WA. So for those of you who might not know me, my name is Adele Hug and I am an oncology dietitian. I've been working with people living with cancer on and off since I started my medical career in 2002, but I've been an oncology dietitian for 12 years now. So working in lots of different spaces. Most of my career was in England, but now I work and set up here in Perth, where I'm from originally. I had a really amazing introduction and career in the UK, supporting a lot of ladies and families and men with breast cancer across the whole spectrum of the cancer pathway. So hopefully what I'll be able to do is take you through some of that experience, take you through some of the evidence, and really be able to help you and your families eat well with metastatic or advanced breast cancer. I've got some notes in front of me that I'd just like to check in that I've read everything so I don't forget to tell you something important. And forgive me, I've got a little bit of a wheeze with a lovely one of these bugs that's going around at the moment. So this is a little outline for today. So I'm going to talk about some treatment pathways with specific discussion around immunotherapies. As in West Australia, most of the immunotherapy regimes are used for advanced or metastatic breast cancer in the breast cancer pathway. I'm going to talk about decisions around stopping treatment and eating well during treatments, understanding malnutrition and nutrition impact symptoms, which is something that I really find important, very passionate about, and we'll finish with some fact and fiction and Q&A. And the other sessions that I'll refer to today that you're welcome to watch back on, but like I said, there is some duplication, so hopefully you'll feel like you understand and have a good sort of overview of things from this session today. But the information is very general and each of you will have a different story. So do make sure you listen to your body, chat to your team if there's anything specific that you want to run by. I think that's what's one of the important things. So obviously, when it comes to treating metastatic breast cancer, there are lots of different options and lots of different combinations. And there's over 40 sort of neoadjuvant and adjuvant treatments, and there was over 45 palliative treatments that I could find that are sort of on the standard regimen in Australia. That doesn't include clinical trials as well. So there is a whole realm of combinations of treatment that comes with different consequences of cancer treatment. And alongside these are important decisions to make, depending on where you're at. And eating is definitely a support for that. So what I wanted to have a little bit of a deep dive into is some of the immunotherapies. So immunotherapies are an interesting recent addition to cancer treatments. And I'm no oncologist, but I've supported a lot of people who have had immunotherapies. So when I started in England, we were working alongside the original immunotherapies that were working on malignant melanoma. So a lot of the side effects and consequences of those treatments are quite different to some of the more traditional, I suppose we'd say, chemotherapy treatments. So it's sort of brought a different realm of managing side effects and eating well alongside immunotherapies. So immunotherapies are a group of sort of monoclonal antibodies or chemicals. And what they actually do is bind to a certain protein on the tumour, or help our T cells, our immune cells, find a certain protein on the tumour. So usually cancer cells are very good at evading our normal immune system. And this is one of the reasons why they're able to multiply in the way that they do. So this actually allows our own immune system to fight off and recognize that a tumor isn't something that should be in the body. So it is a new style of treatment, and it comes with new side effects. And I will talk about those a little bit later. They're obviously not for everybody, as when a tumor is assessed, we look at the different markers on there. So unfortunately, there might be some tumours that it's not appropriate for. And for the majority of people, they're used in combination with other therapies. So then you're juggling lots of different side effects. So it's just something to think about. But before I wanted to chat about eating well during cancer treatment, I wanted to briefly discuss food, eating, and stopping treatment. So food is obviously a very broad name for lots of different things, and food can mean something very different to each and every individual. But then when it comes to nutrition, this is definitely more the scientific way of eating to support body functions in a nutritional way. And it's not as simple as being able to pull apart these things and what they mean to you. There's lots of nuances around food and nutrition. It's very individual. And food is definitely a support for alongside treatment. But if there is a decision that you and your family and your medical team take to stop treatment, food is definitely a support to continue. Food can really help boost your quality of life, your strength, and your ability to do the things that you want to do. So it is an important thing to consider. There are also, though, natural processes that do happen as the body slows down, like digestion slowing down. And as we near the end of life, we don't feel like eating as much. And some of those challenges and discussions around with our loved ones can be some of the hardest to make. So the more you can talk a little bit about what you're feeling, what your wishes are around eating and drinking with your whole team and your family, that's super important. I'd also say that this can change as well. What's important to us at one stage can definitely change, and that's absolutely okay. Sorry, I'm just making sure I'm not getting messages from you guys. I think one of the other things that I would say is the treatment for nutrition impact symptoms is super important at the whole spectrum, on and off treatment. There isn't a reason to be uncomfortable, and I'll come to some of the ways that we can support that with eating and other ways as we go through the session. But I thought I'd start with some basics of what's important to eat during cancer treatment. And this is a very general part of the session. I would say you might have heard me talk about some of these before if you've been in any of my other sessions. So they do ring true through whatever treatments you're having, the same base. And it's very similar to a traditional eating, but there's a few tips and tricks that I would say. And one of the main thing is to make sure that you're catering for what you like, what your allergies or preferences are, because this is just the basics and it's making it work for you and what you need and what you enjoy. So protein is definitely the key nutrient that I bang on a lot about. So protein is the building blocks for our body. It supports our immune system. It supports our movement and all our a lot of our body functions as well. And it's increased requirements after a cancer diagnosis through the whole spectrum of at least 1 to 1.5 kilograms per body weight per day. The numbers don't mean a lot to some people, and that's absolutely fine. I just say have protein with every meal and try and have some protein snacks during the day. So you've got a lot of options, plant-based options, you've got animal-based options, and there's even some supplements like milk powder or pea protein powder if you're finding that you need a little bit of a boost. There is some evidence that animal proteins are absorbed a bit better, especially during treatment. So there isn't any need to go vegan or vegetarian unless you want to during treatment. It's one of those nuanced issues, and it's something to think about. But including some animal protein can be of benefit if that's your choice. But you can definitely meet your protein requirements on a vegan or vegetarian diet. It just takes a little bit more work. The next section is energy. So energy comes from fats and carbohydrates. So these foods are some of the protein foods as well, but also some carbohydrate or fat-based products. Things like oils, avocados, nut butters, those kind of things. There's actually, and I should have put it on here, things like cream and dairy are great sources of energy as well as protein. So I've just missed that off. That total miss on my part because those are really good energy sources as well and can be really nourishing for you if you are struggling to eat and drink a little bit. And they've got other important nutrients as well. So I will be sure to update my slides after this and add those on there. And then we have fiber. So fiber or plant-based foods, lots of different fibers. It's more of an umbrella term, and all these different fibers have different actions, especially in our gut. They help our gut bacteria, they help our bowel function, and there is some sort of energy producing that they do in our large bowel as well. So there's a host of functions that the bacteria do in our gut that are fed by these fibers. And the reason why it's even more important for some people is there is some evidence that having lots of fiber varieties in your diet when you're having immunotherapy may support that immune function. And that immune boost that comes after immunotherapy. So it's definitely something to think about, making sure or having a look at the fiber that is in your diet. I'll come to it a little bit later, but the other thing that can come with treatment, though, is a little bit of bowel discomfort and can be quite, there is some side effects that can come from some things like immunotherapy where it's colitis, almost very, very bad diarrhea. And then it might be time we would address things in a different way. So it's another example of whilst high fiber diets are a great suggestion for many people, for some people it's actually going to be quite the opposite, even if they're on the same treatment. So definitely where you're at is the most important thing. But if you're able, more fiber is a great option. So the other thing that can happen, obviously, when you're having different treatments, juggling everything that goes on with metastatic breast cancer, it can be really tiring to cook, shop, all of those kind of things. So anything that you can do to help make things easier for you and the family is super important as well. Lean on people to stock the freezer, having those things that you can make really easy, making in bulk or slow cooked meals, snack meals like baked beans, eggs on toast, they all count and give you really important nutrients. So don't feel that you need to go for maybe your traditional meals, even if it's straight for dessert some nights. That's okay. Being fed is what is important. And the other thing that goes hand in hand with eating well is physical activity and functional movement, where we're wanting to keep the body as active as we can, and especially things that you like to do. They're always going to be the easiest to do. We know that people after a cancer diagnosis often drop their exercise, but actually one of the things that we wish and want to prescribe more is exercise along cancer treatments. And this is for any cancer treatment. We know it can really support the body to recover. It also has a role in our immune function and lots of different parts of our mental health as well. So physical activity and keeping active is really important as well. I probably said it last session, the frequency, the sort of acronym that I use of a way to focus on what's important or what you can do is FIT. So it might be that you look at the frequency that you do some exercise or some activity and be able to increase the frequency from maybe 3 to 4 times a week. It might be that you can change the intensity. So you're doing your 3 sessions a week, but you might want to increase it and do more hills, or increase so you get your heart rate and your breath rate up a little bit. But hopefully not for an infection, but for lots of hill climbs all the time. So it might be that you want to still do your 3 sessions a week and the same sort of intensity, but you can add on another 20 minutes. And those ways are definite ways to increase your movement, especially of the things that you like. And we know that really supports the body and really helps that extra protein that you're eating to store as muscle, which is the real thing that we're monitoring when we're looking at sort of nutritional status. So if I move into understanding malnutrition and nutrition impact symptoms in the next session. So I definitely covered some things around understanding the different types of malnutrition, and there's quite a few, and they do overlap. And diagnosis isn't easy. But what I wanted to talk about today was a particular type of malnutrition that is very common in cancer, and that's called cancer cachexia. So what we've got on the left here is pre-cachexia and cachexia. So cachexia is a complex syndrome that changes how our bodies use protein, carbohydrates, and fat in response to certain chemicals and inflammation in the body. And there's a certain interaction with the immune system. So it's a really complex and overlapping syndrome. And once it's fully established, it cannot be reversed. So what we like to look at is early pre-cachexic interventions that can help support your body and nutritional status to be as strong and as well as possible. It's generally different to weight loss, and it always does involve muscle and fat loss as well. So it involves a lot of those storage, movement, and sort of parts of your body that actually help to keep you well. Treatments can't fully reverse it, but there are some combinations of treatment that can slow things down. And that's why I put this little picture on here to remind me to talk about some of the things that we know can help. And there is research ongoing into cancer cachexia alongside other treatments, like other cancer treatments, to help support or delay the prognosis. So it's another watch this space, but we do think there's things that we can do to help support and delay cancer cachexia. So some of those are around eating. So I'll start with some of those first, and they're similar to what we talked about before. Protein is the key. So making sure you've got your protein, but it's also things around good fats. So good fats have a role in dampening down the inflammatory response in the body, or the chronic inflammatory response. So having things like olive oil, salmon, those kind of things, avocado are a good thing to add in. They're also very energy dense, so they're great if you're struggling to eat your normal diet. Fiber is another key, especially things like pulses and lentils where they're added in with some protein. So they're another goodie. And those are the main sort of additions into the diet that I would say hopefully aren't too much, but definitely may have a benefit for delaying cachexia. And the other thing that goes with it is keeping your muscle mass up. So that's the exercise or the functional movement. So it's not new, but it's just another reason why these things are talked about and important to try and incorporate. And I think the other thing to mention is that if you are struggling to move for whatever reason, I'll come to some of the reasons in a minute, but do reach out for some help. There's lots of physios that can support you or exercise physiologists, because you really want to be set up for success. And it can be a challenge when you've had lots of different surgeries and you could be, you're on treatments for a long time. These things, that's what the support services are there for. So definitely reach out. Just make sure I've covered everything. Yeah, cool. All right. So I think this kind of goes hand in hand with the last slide about why do we worry about malnutrition? And this is the same as why do we worry about any type, like having cancer cachexia? Because it can make your treatments, you struggle with your treatments more, so you feel more side effects from your treatment, or you could need dose reductions or have more breaks. And this can then affect how the treatments can work. It can affect your quality of life and how you can get around, can affect your wound healing and recovery from treatments, and can contribute to fatigue. So that's why we like early intervention, whether it's in a pre-cachectic scenario or any sort of weight loss, muscle loss, is the thing that we like to get on top of a lot earlier. So it's hard to tell if you have malnutrition. How would you know? Your weight doesn't always give us the best indicator. It's often one of the main things that we do look at, but unfortunately it doesn't give us enough of a picture of what's going on inside. You can see that the scan on the right, there's much more muscle in red compared to the scan on the left. And these are same weight individuals. So it really doesn't give us the picture of what we need when it comes to that muscle, is the muscle mass that we're really trying to hold on to. Now, I know I went over this in a previous session, but I did want to keep it up because I think it's got some important tools that you or your team can use if you're ever worried about malnutrition. It's a type of screening tool. So it's good to ask your specialist team if they have their own screening tool and they can run you through. It's mainly, again, it is around weight loss, but there are things around if you're eating less or if you have different symptoms. And I'm going to go over some of these symptoms because these are those nutrition impact symptoms that I come back to a lot, because I could tell you till I'm blue in the face different things to eat. If you're struggling with symptoms that are uncontrolled, it's going to be a big struggle to eat them. So that's why I definitely focus on those. And then we talk about that activity and function. So it is that sort of joined up why I couldn't just talk to you about one thing around just food. They're all together to really make sure that we're covering all bases to have that food as the support for treatment and eating well. So if we move into nutrition impact symptoms, so obviously the cancer can have certain impact on symptoms as well, but many of these are actually treatment related as well. So it can be a combination of both, but anything that's impacting your ability to eat normally. So they can be sort of chemical issues with after chemotherapy, like anemias can affect you. Different surgeries that you may have had can have an impact on how you eat or how you your function is. So breathing, especially with breast surgeries, it can affect function and fatigue. So all of these things can obviously have an impact. Many of them are affected alongside your gastrointestinal system. So that's why I've put this little picture up, because they can happen along the whole spectrum, especially when we throw in a lot of different combinations of treatments. And what might be many years of treatments, and maybe going onto one treatment and then back off onto another treatment. So with metastatic breast cancer, you can definitely have that build up and some of those longer term consequences of cancer that can then double up with a new treatment side effect. So we'll have a little bit of a deep dive in some of the things that we can do for some of these. And I know I did talk about some in one of the other Eating Well sessions. So if there's anything that you want more info on, let me know, because it's definitely something that I'm sure we can talk about. So one of the ones that I hear most commonly is loss of appetite. and it's super common. It can happen due to most systemic anti-cancer treatments. So by those, I mean chemotherapy or immunotherapies, or certain targeted therapies that you might have. Radiotherapy can cause a loss of appetite, whether it's breast, bone, those kind of things can cause, have that as a side effect. Nausea will cause a loss of appetite. I see, and again, I talk about this one a lot, but constipation is one of my top causes for a poor appetite. It happens a lot with treatment. We're really good at treating nausea now, not so good at recognizing constipation. So it's one of the things that I often talk about a lot, because if your bowels are any less than normal, it can really impact your appetite. Cancer cachexia as a disease can actually impact and decrease appetite in the way that affects our metabolism. And it is a natural process as we near the end of life to have a loss of appetite as well. When I do these tables, I'll always put a medical treatment prior to a nutritional strategy. Now, this isn't because I don't think the nutritional strategies are anywhere less important, but in my experience, we often need medications or medical treatment, especially when it comes to causes of nutrition impact symptoms, to be able to treat them, to then be able to implement the nutritional strategies. So that is often why they are one of the foundations that I will talk about. So it's treating the cause. So if it is pain that's causing a poor appetite, it's managing that pain. It might be taking anti-sickness tablets, it might be taking laxatives or other medications. So they're always one of the key to then allow people to be able to eat and drink a bit easier. So things that can go along with the loss of appetite, it's relaxing, healthy eating, that traditional. So some of those things that I talked about before, it might be focusing on more energy dense foods. And at the end of this part, I will go through some little energy dense, high protein, high energy foods. So it's sometimes relaxing some of that healthy eating to get your energy and protein in. Small, little, but often, rather than a big meal, because it can sometimes really put you off to have a big meal in front of you. I often find that one of the discussions that maybe I'm mediating with a family, because food often means so much more than just that nutrition, and someone, if they're not eating, wants to feed the other person. And those discussions can be quite difficult, but if we can get the small amount of calories in a small amount, then you might go back for seconds, and that's absolutely fine. And that's often the best way to manage it, because that big portion can sometimes just put you off from the start. At the bottom of this, I've put oral nutritional support and appropriate oral nutritional supplements. So these will come from a health professional or a dietitian, and they're special medical prescribed supplements that you can get that generally, most of them are nutritionally complete. Some of them will just be a supplement to your diet, but they're another tool that you can use to boost your nutritional intake if you need to. And I've also mentioned specialist support here with EN and PN. So EN is short for enteral nutrition. And what this is a tube feed. So you may or may not have heard of these things. They're used more in hospitals for a short-term feeding support, where there might be a tube through someone's nose or directly into their tummy. And this helps supplement or fully support their nutritional status. And parenteral nutrition is, it doesn't go through the enteral system, it goes parenterally, so through a vein system. So it's put in through special lines that is fed through the vein. And this, again, can be fully or support of nutrition. Now, these things can form part of someone's nutritional care plan. It's very hospital heavy, those kind of treatments, but for some people that might be needed in the short or even medium to long term. So there are other options, and it's something that you might want to discuss with your team. Everyone's situation is different, and it's not very common, but they are sometimes utilised for someone who is really struggling to eat for different reasons. So that is definitely something I wanted to include to share with you. And they are actually included on most of these slides, just because they are an extra addition. So another nutritional impact symptom that's quite common is a sore mouth. Treatments can cause this. Dry mouth can cause it. Actually, sort of malnutrition or cancer cachexia can cause a dry mouth. Different medications. I know I'm on steroids for my lungs, and that is giving me a massive dry mouth. So it's something that can impact your ability to eat because you have a dry mouth, it's very sore. Lots of different things can happen there. So oral hygiene is one of the foundations for this. I'll often say to people, maybe get a baby toothbrush because sometimes your toothbrush might be a little bit too hard for your gums and it might be irritating you. So start fresh, get a little baby toothbrush, even if you're not using toothpaste, just to give your mouth a clean. Different mouthwashes are available. There's, if you've got ulcers, there are different coating things that you can use. And painkillers. Oral painkillers before you eat can be an option to make sure that it's not affecting your eating or limiting your eating. The other thing that's common for different reasons, treatment or high blood sugar can cause oral thrush. So that's something I would assess for, get assessed for. And high blood sugar, especially if you're on longer term treatments, on lots of steroids, that can increase your blood sugar and give you a certain type of diabetes. And I'll talk about that in a little bit because it's not managed the same way. And pain assessment and treatment. So like I said, painkillers, if you've got a sore mouth, it really can impact your ability to eat. And a few less meals can really affect that nutritional status. So making sure you get appropriate painkillers can sometimes really help. And then it makes it a bit easier with some of these food strategies like manipulating the texture of foods, more gravies, more soups, more stews. When it comes to those type of things, though, you don't want to dilute your food too much into it being too watery. So you can dilute things with like creams, custards, adding extra oil, those kind of things that can make things that bit more nourishing so that even if you're making it a little bit more liquid, there's still enough energy and protein in there for yourself. And again, oral supplements or specific nutritional interventions might be needed if it's a continuing problem that's really affecting your eating. Pain can be disease related, can be treatment related. And again, I see a lot of abdominal pain caused by constipation. And again, the medical treatments always come first. So pain as a symptom or something that your body is going through will trump over your ability to have an appetite, to have energy. So pain will trump across a lot of those things. So treating the pain can often be the first thing to be able to then do some of the other things. So it's, again, an important thing to engage and make sure you've got appropriate pain support. Alongside most painkillers comes constipation as well. So it's getting that active support for your bowels. So it can be laxatives. Usually if it's medical cause constipation, I would say you need medicine to treat it. So what you don't want to do is rely on foods, especially fibers that often fill you up without much energy, rather than having a laxative that means you can eat those energy rich foods. So it's a little bit of a complex mapping of different foods depending on what you need. But I think what I want to get across is that it's not one size fits all. To stick with that sort of healthy style eating, there are lots of other things that we can do with the use of different medical treatments to be able to help you eat and meet your requirements. And hyperglycemia. So hyperglycemia means high blood sugar. And it's another symptom that I used to see quite a lot in clinical practice for people who had lost weight and were eating quite well, and they didn't really know why they were losing weight. So alongside cancer treatments to help with a lot of the symptoms and side effects are steroids, and they're a great drug to really help for many different reasons, and people can be on them for loads of different reasons. But one of the side effects, especially if you're on them for the sort of medium term, can boost up your blood sugar. And then if your blood sugar's high, when it's above 10, so it's usually, we like it between 4 and 6. If it's above 10, you start to wee it out. And then that means you're losing calories through your urine. So If it's something that we're worried about, we'll do a blood test or a urine test. So that would happen with your doctors or your nurse. But then it's how we manage it and what's causing it that we might do some different stuff around. So some people may have just not had a diabetes check for a while and actually have a new diagnosis of diabetes that we would need to support. And that's fine. We can definitely do that aside. It's one of the things that can happen when we're having cancer treatments for a longer time. Some of the other health things that can crop up along the way don't always get diagnosed as quick, or we might not think about them as much. So I see that happen, and that's fine. We can definitely support that. But a diabetes diet in the traditional sense of the healthy, super healthy way is not always the right pathway, depending on where you're at. So that's something that I would suggest you grab a nutrition professional to help guide you through. The other thing that can happen is you might have diabetes already and your blood sugars is getting pushed up with extra steroids. So again, we can definitely help support maybe medication changes or different things around that to help support your blood sugars while you're on different treatments. Knowing carbohydrates and what foods have carbohydrates can help to keep your blood sugars stable. And depending on the medications and the risk of a hypo or your blood sugars dropping, you might get some education around that. So it's not as easy as just a diabetes diet, but I do think it's an important thing to recognize that it can happen, that our blood sugars can go up a little bit around our treatment due to some of the different medications, or just that it is something that was going to come as a diagnosis and is coming alongside things, and it's how we manage things to make sure it's not affecting the nutritional status and go from there. So I mentioned a couple of times before that we relax healthy eating as a traditional way of eating if we're struggling to eat. And this might not even be all the time. So it might be during certain times of your treatment cycle that you struggle, but having these extra days where you're relaxing some of that traditional healthy eating to eat a little bit more nourishing can then help your recovery and back into the next cycle. So that's ultimate goal, is that we maintain that nutritional status for that next treatment goal. These foods are also super nourishing for you if you're struggling to eat, or that you've stopped treatment and you want some energy-rich foods as you're not eating as much. So you can see these high protein, high energy, lots of snacks, meat, fish, cheese, dairy food, eggs, tofu, nuts and seeds, yogurts, milk or milk powders. Soya is a equivalent in protein than dairy, not in energy, but in protein. So if you choose to try that, other dairy alternates aren't very high in protein. So it might be something that if you wanted to, you might add a pea protein powder or another vegetarian protein if that was something that you were looking to boost with. We've got things like avocado, dried fruit, oils. All of those things are super nourishing. And thinking of little cheeky snacks that don't need to be a meal, but will give you enough energy as if a meal, like beans on toast with cheese, or cheese and crackers is a great snack. Drinking energy is another great way of getting your energy in as well. So smoothies with milk or protein powders, those kind of things can be something you want to try, and definitely have a go. And then it's if you're struggling with your eating and drinking, you've tried a lot of these things, it's where to go next. And that would be where I would ask for a dietitian referral, or ask for someone to give you a bit of extra support with your eating at your treatment centre. And that might be whether it's with particular eating or with some symptoms that you're finding a bit uncontrolled and are affecting your eating. So if you've tried a lot of these sort of first line things that I've talked about today, definitely, if it doesn't work, that's when you head down and have a chat to your healthcare team so that they can help to support you, because the longer that you might struggle with eating, the harder it is to get on top of sometimes. So there's lots of other, well, I don't need to tell you that there's lots of other consequences of cancer treatment, and some of them do have a sort of a nutrition component. Well, they all kind of do. So, if you have any consequence that's affecting your life, it ends up being a challenge to do the things that you want to do. or that you need to do, which are things like eating and drinking for yourself. So sometimes it's taking a step back and having a look at some of these other things that you can get support for, whether it's cancer-related fatigue or mental distress. If you've had some changes in your thinking or your focus or your hearing or vision, have a chat to your nurses. Endocrine, hormonal, menopausal changes, and how to manage those can definitely have an effect on our life, our quality of life. And alongside our breast cancer treatments is some of them have an increased risk of cardiovascular disease or bone changes. And depending on what surgery you might have had, there might be lymphedema that you're dealing with as well. So there's a lot that can be affecting you in your life. And these things can have a knock-on effect for your eating. So I would always say to reach out for these, to support, to see if there's ways that we can make it easier for you, whether that's through Breast Cancer Care WA and some of the services that are there, or your cancer treatment centre, or your family and friends, all of those things, you know, anything that's becoming a bit of a block, definitely get on top of the support to see if it can boost anything and make it all that bit easier. And fact or fiction? Wow, that seemed to go really fast. I managed not to cough. The one thing that I just wanted to talk about briefly before we go into a little bit of a Q&A is around some alternate diets and the sort of difference between alternate and complementary therapies. And ultimately, there's lots of different alternate diets. And I was sent a few as I started these sort of series of talks. And a lot of them are around restricting certain nutrients and maybe adding in something specific as a touted a bit as a cure for cancer. And most of these generally don't have any evidence behind them, but actually have a real risk to affecting your ability to be able to maintain your nutritional status and then have the benefit that that nutritional status has on your recovery and being able to cope with treatments. So what I always have is an open and honest discussion with people who are exploring different therapies and making sure you're linking in with your team, your pharmacist, to make sure there's no interactions and those kind of things, and see sort of what's going to work for you in your specific situation. So everybody is different, and it's kind of making the best risk reduction and supporting your body during the treatments that we have that evidence that do work, as well as fitting in the foods that hopefully that you love and enjoy, and those special moments that you can have with friends and family. All right, I will head to some questions. Let me just stop sharing. Almost left the meeting. Wrong button. There we go.
Stay with us, Adele, please.
Yeah, I know. I didn't cough.
I'm so glad for you. So I haven't seen any questions coming into the Q&A box yet. If you're thinking about something, please do write in. Adele will be able to see that, and I'm looking at the box now. So I can see that someone has raised their hand. You won't be able to speak out loud because it's webinar style. So I'm sorry about that. It just means you won't wind up on the recording on our website either. So it keeps your privacy. But if you could type in, that would be awesome. Use either the Q&A or the chat bubble. While people are typing, I had a couple of questions, as I always do, Adele, and I never mean to put you on the spot because obviously I come from a research perspective. So sometimes my questions are a little bit different, maybe from other people's. But I was thinking about the very interesting topic around the microbiome and immunotherapy. And I wondered what your thoughts were. I've heard of people going and having some tests done to see whether they have the particular strains of microbes in their gut bacteria that might be associated with more benefits. Can you talk about that? Is it worth getting those tests done?
So I can definitely talk about that. And I would say at the moment, it's not worth it unless you're in a research trial. because we don't have enough information on a lot of the strains that are going to be of benefit. And we also don't have enough information on how we can boost those strains. So it is, you might have the right strains, but how or not, but we don't have an intervention that's going to support you. There are interventions, though, on the horizon. So this is a hugely researched area, and there's lots of different bits of information coming out. It's super exciting because we might have, you know, a dietetic intervention that we might be able to manipulate diets. And they're even looking at fecal microbiome sort of transplantations. So people who do have the better bacteria composition of their gut, taking out those that sort of microbiome and everything else that comes along with fecal matter. Don't worry, it's a proper procedure. But these aren't available in clinical practice yet. So they're still very researched. What we do know, though, is that fiber-rich diets can support the good bacteria to grow in your gut. It's an easy and safe intervention. We are a bit worried about certain probiotic use and immunotherapies because there was a small study that did decrease the ability of immunotherapies alongside a probiotic supplement. So, and a lot of it is around antibiotic use and the effects of antibiotics on the microbiome. But whilst it's another one of those nuances, because a lot of people needed the antibiotics as the priority. So it's the ways that we can support someone who needs antibiotics with some diet support, maybe any other interventions that come to be able to rebuild their microbiome to help them support the immunotherapy function. Does that help?
Yeah, it does. Thank you. I think it's emerging, isn't it? It's
It
very
is
interesting.
emerging, and it is exciting. It's definitely exciting because, and I do think if we reflect back and look at recovery, rehab, or even prehab for not just immunotherapies, but things like chemotherapies that just wipe out our bacteria. You know, we could do some good research around rebuilding in between cycles. That immunotherapy's kind of got the glory, but I think there's still a lot of things that we can do with the similar research sort of scenarios with our other treatments.
Yeah, good. I'm not sure if you can see the question in there from Donna. It's about keeping blood sugar low while trying to eat regularly to gain weight or keep weight on.
So I think I might need a bit more information, Donna, on what the reasons are. So I would say if your blood sugars are high for a medical or diabetes reason, and you're struggling to keep them under control to eat well, I often will increase or discuss increasing medication to help support your body. Because if you don't have enough insulin, because for whatever reason with your body, insulin resistance or sort of lack of insulin for a certain type of diabetes, or you've got insulin suppression with steroids, and you need some support from medications to boost that up to then match the food that you're eating to keep your blood sugars under control. So that's where it's medication again form part of that treatment plan. Other things though that will help is moving. So regular moving does help your muscles become more sensitive to your insulin. So even if you're a little bit insulin resistant, it sort of pushes back on that. So keeping moving and keeping your muscles moving will help. They'll suck up the glucose in your blood. So that can help if you're then struggling, and that can then have the knock-on effect to support weight gain. I think a lot of people, I hear a lot of people when they're struggling with weight loss, they're losing weight without trying. They're scared of exercise because they connect exercise with weight loss. But actually exercise helps support weight stability. So it's actually not good for weight loss, but it's another good thing to include. So that might help. Hopefully that answers your question.
Thank you. There's another one there from Chantel saying that, what are your thoughts on the meal replacement shakes that are out there on the market? Are these okay to use?
And I think that's another one, Chantel, depends on what you're using them for. They're definitely a great way of like a convenience product if you need something, but it's making sure the product is meeting your requirements. So a lot of them are diet focused, and will have less calories than you need, but there's a lot more sports varieties out there now that are high protein. Even something that I often recommend is like Up and Go protein as an easy one. It's high protein, loads of vitamins, minerals in there. There are other brands available, but those kind of ones are great. So it's depending on your particular requirement, and I wouldn't say you need to buy them, but they can be an easy way if you want to buy them. They can be a great substitute if you're struggling to eat for whatever reason. Definitely.
Good. Well, not a whole lot of questions. Maybe people are holding them in their minds for another time. So if you registered for this webinar, you will receive the recording, and that will also come through your email, which means you've got a way to contact us if you do have other questions, other things you want to know about. This is a good one. Okay. So another question just popped in. Stay with us. We've still got about 10 minutes to go. Okay. 2 more questions, actually. So one about fasting and the other one's kind of along the same lines. You mentioned some of the fad diets. Can you talk about any of them specifically, such as keto and fasting? And the other fasting question was around fasting before chemo.
Yeah. So I remember chatting about fasting before chemo in another session, but very happy to chat on that again. So the theory behind that is that, well, there's a few different theories, but one of the main reasons it's being researched is for reduction in nutrition impact symptoms or side effects of treatment. And it might also be the impact of blood glucose around how it could affect the benefits if you're in a fasted state of having a chemotherapy treatment. So there is research and studies going on, and most of them are in the feasibility stage where we're looking at, is it feasible, is it safe to fast around chemotherapy, because obviously it is a toxic medication that we're giving people and then taking away their food. Is that is it going to be safe? So it is interesting, and it could be a therapeutic option, but it's not something that's done at the moment in clinical practice. It's only done in research. If it was something that you wanted to try, I'd always chat to your specialist team about it and how it might affect you. I have had certain people try it, and it kind of went both ways. My main concern was that they come back and they'd lost weight, and then you have the risks around malnutrition and recovering from treatment. So it's managing the sort of the treatment cycle and your diet before and after that fast as well. So it's usually meaning that you need a bit of a team around you to make sure you can have that support. So it's still a idea, and it will be interesting to see what the research comes out. But if it was something you wanted to consider, I'd definitely chat to your team to see if there's some support that they could give you, because it's not something that's clinically recommended yet. And I think that comes to in a similar vein to the fad diets. I mean, there's lots of different diet choices like keto or fasting, and people would use them at different times. Like you may have been an advocate of like the 5-2 diet, and then you get your cancer diagnosis. You're like, can I keep going? And it is everyone's different about what's going to work for them. And some people like to eat a keto diet for whatever reason. My job is to make sure your nutrition and your intake is complete, whatever you kind of choose to eat, that you're getting a bit of a range of nutrients from your diet, whatever that's, vegan, most of the diets that are out there, as long as it's complete. And then I get worried, and dietitians and people like me get worried when they cut nutrients out, like no carbs, no, I've had all sorts, no animal protein, no, all sorts of different things that cutting out without considering the effect of that. So what it means and what nutrients you're going to miss out on. So if you're cutting carbs, usually you're going to miss out on all that fiber. And we know so much about the benefits of fiber, so it hurts me thinking about not having fiber in people's diets. Even if they were choosing to cut out the white carbs, that's a whole other different sort of diet. So it's not easy to negotiate yourself around diets, and it's partly why I would suggest you have a look at what works for you and at different times. And as long as you're nutritionally complete, if you're worried, then that's when you ask a dietitian as well and say, hey, can you look at my diet? Is there any risks with what I'm eating in the short and long term? Because you don't want to affect your bone health a couple of years down the line, those kind of things. So yeah, hopefully that answers. It's a bit around the house.
That might lead quite nicely to another question that's there that says, why is dairy not recommended for diet for breast cancer treatment? And I'm not sure that it is not recommended, so you might
That's a great
talk about
question,
dairy again.
Jan. Yeah. So dairy gets a lot of bad press, but one of the good things about bad press is then we research it a bit better. So dairy did get, in the sort of late 90s, early 2000s, there was a lot of fear around diet and dairy and breast cancer, and that it might be sort of some sort of promoter for breast cancer. But the good thing is that there's been a wealth of research on it that's actually shown that it might be protective. So where we as sort of cancer professionals recommend dairy as part of a healthy diet for someone with breast cancer. But I'm fully aware that some people may still choose not to have dairy for different reasons, even if they want, for whatever reason that is. And it's making sure you're getting the calcium, protein, and enough vitamin D from other sources to meet what we traditionally use dairy for. I think we're moving away from so much dairy for our calcium as a sort of Western world, but dairy is definitely still there for many of us. And the other thing, a lot of people use dairy for nutrition support when they're really struggling to eat. As a safe way of boosting calories and intake. But again, there's other ways if you choose not to eat dairy. So it's definitely something that you can eat safely, but ultimately, if you choose not to, that's absolutely fine too.
Good. Okay. Yes, I've seen some of that research around dairy intake being associated with less colorectal cancers. So I do think that's interesting because there's certainly been some fear about the kind of growth promoting aspects of dairy in the past. Yeah. So a question from Amy. She says she's cut out all sugars and all red meat and feels great,
Yeah.
but is feeling weak and fatigued in the afternoons. What key foods can you recommend to replace lost nutrients?
Yeah, excellent. So it would be looking at complex carbs and having enough protein, making sure you've got enough, that you're eating enough as well. But things like grains, pulses, lentils, beans, rice, pasta, those kind of things, brown or white, depending on what your preferences are, as a more complex version of carbohydrate should give you a boost. Even some things like nuts, seeds, oats, muesli bars, those kind of things can give you a little bit more fiber as well. So it's just having a look at those sort of fiber rich foods and seeing if there's anything that you would be comfortable including. Otherwise, it's finding other sources, and it might be that you're just not eating enough. Women are notorious for doing that. So it can be something that you want to add in, just an extra snack. And if you're still not comfortable with some foods, it's having more of the foods you are comfortable with. If the fatigue continues, I would definitely ask for someone to just have a look at your diet, what you're having in a day, and then maybe you can make sure that you're getting everything that you need.
Good one. Melanie's saying, regarding getting enough vitamins like vitamin C, vitamin D, calcium, is there any evidence to suggest it's better to get them primarily via food or via supplementary pills or a combination of both?
So food is the priority for most vitamins and minerals, but there's some that many people we'd recommend a boost in a supplement form. Calcium and vitamin D are common ones. Iron's another one. And it's usually can be driven by your pharmacist or your medical team that would be able to help decide if there's extra that you're at risk of, or also if you are following a more restrictive diet pattern. Sometimes I would suggest an A to Z multivitamin, just a little bit of everything, but not too much of anything. And just if you're on any particular treatments, just double check that that's okay. But that way you're just going to get a bit of everything if it helps you. But there isn't any evidence that you need supplements. In fact, the World Cancer Research Fund recommends no supplements unless they're prescribed, or like vitamin D for cancer prevention or support. So it is usually food, but especially if you're not eating well, it's working on what's going to work for you to get stuff in. So again, not a straight answer. I never give a straight answer.
And that's the sign that it's scientific, right? That there's nuance, there's shades of grey here. And I think it's tricky with nutrition, isn't it? Because I think people want to be told, like, this is the perfect anti-cancer diet and everyone should do this.
Yeah.
But that's just not the way life or our bodies work. So it's
not
good that you're giving these, well, in some cases this, but in other cases not so much. And that's the kind of narrow path that each of us has to navigate. And that's why we need health professionals like oncology dietitians, so that we can check in about our personal situation. So I suppose that's a good reminder to everyone listening to this webinar that none of this is individual advice. This is general advice. If you have an individual nutrition issue, you do need to see your accredited practicing dietitian or another degree qualified nutrition expert who can support you with that. We're right on our 3 o'clock time, but there is one more question in the chat box, which is about dark chocolate and coffee. Do you want to speak to that briefly before we finish up today?
Let's look at what the question was. What about dark chocolate and coffee? So dark chocolate and coffee have a nice wad of antioxidants in there. There isn't any evidence that you need to remove these foods, and there's classes sort of they're fine to include as well, up to sort of 2 to 4 coffees a day, as long as it's not affecting your sleep. So that's the other thing that, the evidence is that 4 coffees a day is fine, but if I had 4 coffees a day, I wouldn't be able to sleep. So it's working out what works for you. The benefits of coffee, though, are still in decaf coffee. So that's interesting, or other tea or decaf tea. So the antioxidants are still there. And when it comes to chocolate, I always say have the chocolate that you enjoy, because there's no point in having dark chocolate if you don't enjoy it, and then you still want to reach for the white chocolate. Like, just have the white chocolate. Just eat the white chocolate. So yeah, it's what you enjoy, and chocolate's a great example of that, of having that enjoyment of food, and that's going to satisfy you, rather than you always looking for something else that you just think is the healthy option. So food is more than health.
It is. It's very much a holistic experience, isn't it? That little comment that you just made me think of my snack last night, which was goji berries in dark chocolate. I thought that was quite virtuous and also delicious.
Good, exactly. That's the thing. So sometimes some of these things also you think, oh, I am being healthy, but they are delicious. So it is experimenting as well. I think that's a good thing to mention.
There's one more question from Angela. If you have enough vitamin D, will calcium tablets still be absorbed without taking vitamin D as well?
So if your levels of vitamin D, so vitamin D is stored in your body. So if you do have enough, your calcium should be absorbed, yes, through the function of vitamin D in your body, definitely. So if you don't want to take vitamin D, the calcium, as long as your levels are up, then that's fine.
Wonderful. Look, I think it's really good timing for us to wrap up. If more questions do come through, I'll be sure to forward them to Adele, and she can respond in other ways. This is the last in our series of nutrition webinars for 2024 at least. We do have a couple of other webinars planned for later in the year, and we are thinking about next year. So if you have topics, ideas, things that you think, you've got burning questions and you'd love to hear Adele or another of our wonderful speakers respond to and talk about and share the science and share the practical information with you, then please do reach out. We've also prepared a survey that we'll send out to get some feedback about the webinars that we've offered this year. So you'll definitely be hearing from us, and please do stay in touch with us at Breast Cancer Care WA. We appreciate you listening, and we'll catch up with you soon. Thanks again, Adele.
Bye. Bye-bye.